Greetings. My name is Dr. Steve Giannoutsos, and I'm here on this beautiful day in our clinic in Jackson Heights called Jackson Heights Orthodontics. We are located on 37th Avenue between 74th and 75th Streets. The address is 7409 37th Avenue. Today I have the pleasure of speaking to you about what we do here, which is orthodontic treatment and the various types of braces that we have. We're going to start first with the most common type, the thing that you may notice on the train, the thing you may notice at the pizzeria, the thing that your children may have. And that is the standard metal braces. And these are the oldest and most reliable type of braces we have. They've been in use for approximately 100 years in one way or another. And as time has evolved, as time has gone on and we have evolved, really the only change that has been made is the fact that we've incorporated colors. So the objective is, as we correct somebody's bite, as we fix their smile aesthetically and improve the way they look and they feel about themselves, in that process, we let them have fun. We make them look good. And particularly for the young children, they really enjoy this. They enjoy this because it gives them an opportunity for some self-expression. The ones that are a little more toned down will tend to pick one color. The ones who are a little more outgoing will tend to have everything. And it's a very simple process where we prepare the teeth and we glue them on. And that is the case for this here and the next three that you will see. And we'll talk about this one in a moment. Now, before we get into some of the more specifics, the question is, why do we want to fix bites? And really, there's two general main answers to that. Those answers are as follows. Number one, it's aesthetics. A beautiful smile gives confidence. We all know that. And the earlier we get that started, the more we can, hopefully as professionals, contribute to a child's sense of self-esteem and opinion of themselves. So we briefly talked about the metal braces. Now, let's talk about somebody who perhaps is an adult, perhaps is in a social situation or professional situation where their preference is that people not notice that they have any braces, or at least make it as unnoticeable as possible. There are options that differ from the metal braces, and those involve something that's a little more white, something that's more tooth-colored, such that if you're close to a patient, you will be able to see that there is something that juts out from the tooth, an appendage. But because it's uniform in color and it's white or close to the tooth's color, from a distance, perhaps where you are looking at right now, you may not be able to clearly see the braces. And these are much more aesthetic than the metal braces, but equally as effective in their treatment. Now, we move to something that is a little more aesthetic. And these start to become more translucent. So rather than having a white or tooth-colored type of appearance, the light shines through them right to the tooth. Not entirely. Now you will notice that these braces have colors on them, even though they are white. And those colors are only there for the operator, for the dentist, the orthodontist, to be able to see when they're placing. At the first brushing, those colors go away. So these are a little less obvious than the previous ones. Now let's talk about the most aesthetic glued braces. And they're these. They're called Radiance. They're absolutely brilliant. They are 100% transparent. And you can see right through the brace to the tooth. This is a gem. It is not plastic or porcelain like some of the other whiter ones that you saw. And these will allow the light, as I said, to go right through, and they're absolutely brilliant. We get the best response by the way of aesthetics from our patients. They love these. Now, for some people, even this very brilliant, very clear sapphire brace is still too much. And they want something that either doesn't show at all, because while this is invisible almost, it does stick out, it is glued to the tooth. And there is an option for orthodontic treatment as well. And that is this. And you may not be able to see that there's anything on this model, but I will show you that there actually is something that is removable. So, there is a clear, removable plastic appliance that is placed on every 2 weeks. It's clipped on. When it is clipped on, it's totally clear, very close to the tooth, and this allows the patient to wear their braces and have their orthodontic treatment done with nobody knowing that there's anything on the teeth. And if they're in a social situation where, for example, they need to drink some wine, or they're just self-conscious about having anything on their teeth, they're simply removed, and then they're just like you and I. They have nothing on their teeth. Now, just want to summarize very quickly, since we mentioned a number of things. There are perfectly clear, totally removable braces. There are perfectly clear braces that are glued to the teeth and stay on the teeth. There are braces that are not perfectly clear, but they're somewhat translucent. They're almost clear. Again, these are also glued on the teeth. There are braces that are the same color as the teeth. So while they're not clear or they're not translucent, there is a uniformity in the color. It looks like the patient's natural tooth color. And finally, there are the metal braces. And these are the ones, as we said, the children have most fun with. Now again, the reason that orthodontic treatment is very important is two-faceted. There is an aesthetic component, which allows somebody to look the way they want to look, smile the way they want to smile. And then there's a functional aspect also. We all know that if we have trouble with our bite and trouble with our teeth, we have trouble eating, potentially trouble speaking. And the objective of orthodontics is to correct all of these aesthetic and functional problems and maximize function, maximize utility, such that it is easy for the patient while they're going through their orthodontic treatment.